Michelle, I'm so happy to have you here for the second time.
Well, thank you. Thank you for this opportunity again.
Oh my goodness. I could not stop thinking and talking about our discussion last time. We promised each other that we were going to do part two. So we are here for part two.
Yes.
There is so much to discuss that, my head is bursting with thoughts and questions and ideas. I'm going to just kind of rehash what we said last time. So you can possibly correct me if I misunderstood what you were saying. So
Sounds good.
basically, many years back, we learned that you had family dogs, Rottweilers, correct?
My husband's family, yeah.
And these dogs kept getting sick and kept getting cancer.
That's correct.
And you started wondering whether there was some sort of connection with them being spayed and neutered. And that's how your research started. And you realized that there was basically very high or serious or severe increase of luteinizing hormone that had nowhere to go because the gonads were gone. So it was latching onto the receptors elsewhere in the tissue and causing inflammation and cancer and all these different problems. And now you have actually proven this in research studies that you have done. And you've been trying to teach veterinarians to
That's right.
do hormone-sparing sterilization, keeping their gonads, and still preventing them from unwanted pregnancies. And last time when we finished our conversation, you were saying how difficult it was to convince the veterinary community to actually change their mindset and the status quo and start doing some procedures, or the procedures that are a little safer or much safer and would actually not lead to all these conditions. Which brings me to the first question for you.
Okay.
It's absolutely overwhelming to think of all the different causes and patients from the past 30 plus years I've been a veterinarian that had inflammatory conditions, joint issues, cruciate ligament tendon issues, skin issues, allergies, dietary issues, cancer. What conditions you have seen being connected to this particular issue, the luteinizing hormone elevation and the inflammatory response? What conditions have you seen are the most common? Or are there any conditions that are not related to this problem? Because it almost seems like everything possibly is related or could be related to luteinizing hormone elevation in spayed and neutered animals.
The problems that we've actually taken back to a lab to study have been hypothyroidism, because we know that happens several fold higher in dogs that have been spayed and neutered than intact dogs, and also being diagnosed in younger dogs and then that have been spayed and neutered compared to intact dogs. We've taken that back to the lab and demonstrated that is indeed the case, that LH receptors are on the thyrocytes and that those receptors are located very close on the cell wall next to the receptors for thyroid stimulating hormone, or TSH. And since both of those receptors use the same cell signaling machinery, namely cyclic AMP, to have the cell do its function, when LH is bound to its receptor, it essentially takes over that second messenger and disables TSH from being able to trigger thyroid hormone production in the cell. So we started off looking at thyroid levels, and that really was because we had found very compelling information in the human literature about how high levels of luteinizing hormone in a variety of human-related conditions resulted in hypothyroidism, specifically those related to menopause. After menopause, ovaries are no longer producing estrogen and luteinizing hormones become very high, but also in women who have had to have their ovaries removed at a young age or have had chemotherapy, and the chemotherapy has essentially rendered them infertile and their ovaries are no longer producing estrogen. So we had all this compelling information from different human studies, dozens of human studies actually, to lead us to investigation in dogs. But then we set our sights on musculoskeletal conditions. And really my big interest was in cruciate ligament rupture. We also looked at the ligament of the head of the femur, but hip dysplasia is such a complicated disorder. From a genetic standpoint, it's a multi-genetic condition. We know that dogs that phenotypically have excellent hips that are bred together can have puppies that have poor to fair hips, and just the opposite. You could breed two dogs with poor to fair hips and end up with puppies with excellent hips. So hip dysplasia is a very, complicated issue. So we thought we'd focus on cruciate ligament rupture first, which is a little bit cleaner, if you will. And lots of factors can contribute to a dog developing cruciate ligament rupture. Certainly breed of dog, the use of the dog. If the dog is more of a sedentary dog, just a couch potato, probably isn't going to be running around as much, whereas maybe a agility dog is going to have more forces placed on that cruciate ligament. And then, of course, weight, obesity certainly adds more stress to the joints and the cruciate ligament as well. But a number of studies, I think that in the paper that we wrote on this, I summarized data from 9 different epidemiologic studies looking at cruciate ligament rupture in dogs. And all of them concluded that independent of breed and even body condition, so independent of obesity, the most important factor that increased the tendency towards developing cruciate ligament rupture was their gonadal status, so whether they had been spayed or neutered. Statistically, if a dog ruptures its cruciate ligament in one side, 1 in 2 of those dogs, so 50% of those dogs, will rupture the contralateral cruciate ligament within a year. So very high proportion of dogs will suffer the same injury on the other leg. And while disorders like hypothyroidism and even cruciate ligament rupture are not typically, like, we wouldn't call them life-threatening problems, they are definitely quality of life problems, and they have a multitude of other disorders that accompany them. So with hypothyroidism, often you have more skin problems, obesity, problems with your metabolism. But with cruciate ligament rupture, if surgery is not done to restore the knee to its normal stability, osteoarthritis will set in, and that will be an extremely painful condition for that dog for the rest of its life. Even if it is a sedentary lifestyle, it will still have
Absolutely the quality of life.
Right.
And knowing that dogs, basically mobility is super important for their longevity, and in humans as well. Like, as soon as we stop moving and our dogs stop moving,
right.
that's a fast decline. So understanding that connection, it's super important.
And it's everything too, because you think that when your dog just goes outside to go potty, how they have to squat and flex in their cycles in order just to assume potty position. So one of the disorders that we see in dogs that have cruciate ligament ruptures that haven't been repaired surgically, and so they've got osteoarthritis, is they start to have inappropriate elimination habits. Of course, I anthropomorphize. I try to think like a dog, but that's not necessarily the best thing to do.
Perfect way to
But
go.
I can imagine that if it hurts to squat to go potty, you're probably going to hold it as long as you possibly can. And then if there's no one there to let you outside at that particular moment, then you're just going to go where
Yes, I understand.
the owners get mad at the dog. And of course, the dog was,
So looking at all the tissues and the inflammation, is there, so, I'm thinking of allergies, ear problem,
yeah.
behavior changes, because as you said, LH levels affect also amygdala and some of the brain regions.
Yes.
Is there any condition that you can think of that is not possibly affected by this luteinizing hormone theoretically? Because I know that you haven't done studies everywhere, and there's some proven studies. But your sense, is it possible that if this issue has corrected, that a large majority or large portion of the medical conditions that we're treating would be less frequent?
I actually have a veterinarian that I'm consulting with in Canada. And the reason why I mentioned Canada is because in Canada, they have the canine labeled deslorilin implant that is available to use without getting a special permit necessary to import it. And in the United States, the only way that we can get the deslorilin implant for canine use, we have to have a special import permit through USDA. And the only deslorilin implants available in the United States are those explicitly labeled for eastern ferrets. And it says right on the label that it's prohibited from being used in any other species, which is really frustrating from a veterinarian because it's exactly the same implant, exactly the same drug, exactly everything is the same. But one says that you can't use it, and then the other one is difficult to get legally in the US because you have to go through all these hoops and paperwork. But in Canada, since the fall of 22, spring of 23, the desloratadine implants have been available for use in dogs. And then, of course, because they're not prohibited from use in other species, they can be used in dogs for a number of different applications as well as in cats. And so this veterinarian that I'm consulting with, she'll call me and she'll say, well, what do you think about seizures? And I'm like, I don't know. And so I'll do some research and say, well, sure enough, it shows that there are a higher number of seizure activities during certain stages of the estrous cycle or the menstrual cycle in women. So those are stages when there would be higher levels of LH present. And so we are even treating some dogs with disorders like epilepsy with GnRH implants to lower LH concentrations. But she herself had a dog that was getting a cytopoid injection every 2 to 3 months to control atopy. And she put a desloratadine implant in her own dog, and it's been over 6 months now. And the dog has not needed any cytopoint to control its itching. And so she's really sold on the relationship between at least the skin manifestations of allergies and high levels of LH. The reason why I say at least the skin manifestations of allergies, because certainly you can have GI manifestations from food allergies, and those maybe have some component related to LH as well, but we haven't gone there yet. But your question for me, is there any condition possible? And, I can speculate on a lot of things. Certainly we see, heart failure in aging dogs, and I can't think of how high levels of LH could be associated with heart failure. And I can't think of a situation how high levels of LH could be associated with renal failure, kidney failure.
Mhm.
But I also can't think of a reason why giving a desloratadine implant to those patients, especially if they have comorbidities, and they often do, how there would be any potential health risks. Now, I know that you and I had spoke about your dog, and you had mentioned the implant label itself says, there's a potential, and then it goes on to list a number of side effects that were reported. And I talked with a technical service representative about those, and she didn't have any specific information, but she said that when they did these studies, they have to report everything that the animal does after the implant goes in, whether it is related to the implant or not. And so that's where that potential side effects, that list comes from. In my experience, I haven't seen any of those potential side effects in sterilized dogs. The two main side effects I've seen used with the implant have been with intact, so not spayed and neutered dogs. And with male dogs, when they get the GnRH implant, even though it will eventually render them infertile, they go through a hypersexual phase for maybe 4 to 10 days after the implant goes in. That can be everything from marking on things in the house to mounting things or other dogs to maybe even some aggressive tendency towards other dogs just during that period of time. So I warn intact dog owners about that possibility because, we want to protect everybody from, potentially injury if there is any sort
I'm going to backtrack if it's okay, because some of our listeners may have not heard the part one. So I'm just going to repeat what we discussed last time. So basically, we know that ideally we should do hormone sparing sterilization. But for those dogs who have already been spayed and neutered the traditional conventional way, they have been affected by this problem of elevated luteinizing hormone and their methods of neutralizing it. For everyone else, and we talked about it last time, by repeating it, I'm also learning the hypothalamus basically produces GnRH, gonadotropin releasing hormone, that stimulates the pituitary gland to produce the luteinizing hormone. And we are able to use medication and agonists against the GnRH that basically prevents the formation of the luteinizing hormone. And we basically...
The agonist doesn't prevent GnRH so much that it binds to the receptors on the pituitary gland and prevents the release of LH. And that's why we see in male dogs this initial kind of hypersexual stage that will happen because of the initial surge of LH that occurs when the implant goes in. In female dogs, if they are intact and they are not in heat at the time that the implant goes in, the implant can actually bring them into heat. And we did research using a similar Deslerelin implant back in and where we intentionally use the implant to bring dogs into heat, because for people who breed dogs, one of the most frustrating things about breeding dogs is not knowing when your dog is going to come into heat. They have a very long period of months or maybe even a year or more between each cycle.
Yes.
If you want to breed to a certain male dog, it's only available during a certain time of the year, or you want to have puppies, but you don't want them to have puppies, over the holidays or something like that. It's hard because inevitably they'll do just what you don't want them to do. And so using this drug to actually induce estrus and induce ovulation, induce a cycle, it is really helpful too. But if you're trying to use it to prevent cyclicity in female dogs, that's a challenge, right? Because the very first thing that will happen is it will induce them to come into heat. And then it'll prevent them from coming into heat for several months later.
One of the reasons why I became curious about this whole thing is that after I neutered my dog Pax, he was amazing. He grew up strong and his coat was amazing and everything. And he still is a strong dog, but I could start gradually seeing a tendency for him to get injured from the activities that he loved, whether it was on the beach and so on. So since the last time, and I've been kind of deliberating over what to do about his injuries, and I tried physical therapy and acupuncture, and obviously he's on good supplements and omegas and all that, but he still had that tendency to injure. So since the last conversation, I just want to say this to everyone else. We got together and we communicated, and I kind of took the leap of putting Pax on suprelorin pretty much within 24 hours. Like the first 12 hours, he slept like he ran a marathon. And since then, he has not had one single limp. I see that his inflammation all over the body has reduced. Isn't
that amazing?
He has been playing and screaming and doing all that stuff.
And this is what everybody is saying about this drug too, is how amazing their dogs are afterwards.
Oh my goodness. It's such an eye-opening experience. And I, as a person who tries to prevent any medication, most of the time, I basically would just say, we can fix this without medication or anything else. I had this 4-year-old dog who did not make sense. Like I just could not really sort it out. Everything that I did in the past didn't work for him. And I knew that there was something else. So I'm very grateful to you to actually give me the guidance and the courage to do this. And now, first, I did not know that suprelorin was not available in the United States, which is probably one of the things that we really need to work on as a community.
Yes, I agree.
Second, I know that Dr. Becker has a petition, hormone-sparing sterilization going on, and I will post a little link in the comments of this video. Third, if you have a dog, or if someone has a dog that is suspected from having this reaction or response to being spayed and neutered, would you first measure the luteinizing hormone, or is it pretty much given that the issue is there? Would you not do that and go directly in the medication? And the second question, or part of the question, is when we put them on the GnRH agonist that prevents the luteinizing hormone from being released, right?
Yes.
Would you put them on hormone replacement therapy? Because that's the next step, because these dogs lose muscle mass and they basically are missing these hormones, not just for sexual function. They miss these hormones in the body for other organ and body function. And so what do you do?
Well, let me answer the second question first. So for male dogs, I guess it makes sense to supplement them with testosterone or an androgen of some sort. But supplementing female dogs with the androgen often doesn't make sense to us. So using an androgen supplement for dogs, especially when they have considerable muscle atrophy or their metabolism has significantly slowed and there is a real problem with their metabolic state, managing obesity, then we've used both injectable testosterone as well as methyl testosterone orally. One of the biggest problems with testosterone is that because it is an anabolic steroid, it's a controlled substance, of course, abused by humans. So veterinarians in general have some reluctance to just dispense, especially oral testosterone, to dog owners, because unless they're have a very good trust with the owner, they're concerned that it could potentially end up being abused by humans. That's one of the biggest problems with testosterone. There are also some testosterone related conditions in dogs that, of course, we try to manage in intact dogs. We haven't really studied them as well in neutered dogs with testosterone replacement, but I would be remiss if I didn't mention that there are some testosterone related adverse conditions that could occur.
Prostate enlargement, for example, any other?
Yeah, perianal adenocarcinomas, probably the more, significant, even more than prostatic enlargement or prostatitis. But for short-term use, especially if you were doing, maybe a 3-month course just to get a little bit more anabolic activity going on in the body, I don't foresee there being side effects associated with more of long-term testosterone exposure like you'd expect to see in an intact dog, but I don't have any research data to support that. So I'm just putting that out there.
When it comes to the testosterone replacement, dogs may benefit, but there are also some possible side effects.
That's correct.
Is there a difference between the oral medication and the injectable on the level of effect? What is the dose that you would normally use? Like, is it a minimal dose of, let's say, 0.5 milligrams per pound or kilogram? What doses do you use? And is there a difference between those two formats or forms of medication?
So the injectable format tends to be much more bioavailable. So we see a more profound response with the injectable formula. And there used to be anabolic steroids available that had very minimal androgenic activities. Winstrol V is an example of one. The drug name is stanozolol. It used to be available for small animal practitioners, and I remember using it right after I graduated on cats with renal failure that had severe muscle loss. That particular drug is no longer available again because of the human abuse issues. I wish I could quote you a drug dosage off the top of my head, but it's not a drug that I routinely prescribe, so I wouldn't be able to tell you an accurate dose off the top of my head. But just another caveat is that the veterinary formularies may have some dosages available, but actual pharmacokinetic studies on many of these human anabolic steroids haven't been done in animals. So again, that's another reason why I'm a little bit more cautious prescribing testosterone. Could have adverse effects on the liver. There are other potential side effects that I try to avoid with testosterone or androgens unless they're absolutely necessary.
I understand that. And so, when I had an interview with Dr. Linda Brent, I know that one of her dogs, it's so interesting how dogs teach us.
Toby, yeah.
One of her dogs is on suprelorin and also on the testosterone supplementation. And I think that it would be really interesting to see what the minimal dose to actually get the desired effect would be, right? Like starting really low.
So we actually had Toby on testosterone for at least 3 months. It might have been more than that. Linda took not, serial blood samples to measure LH from Toby while he was on testosterone. And we were never able to bring LH levels down to even the single digits.
Yes.
Yeah, at one point, Toby's LH level was in the 90s. And just to give you an idea of what normal is.
3 or 4, right?
A female dog at the time of ovulation, when her LH level is as high as it's ever going to be, it's 1 nanogram per mil.
Oh my goodness.
So in the 90s is incredibly high.
So incredibly high to the point that it's causing so many different issues because this is an unnatural reaction. So
that's right. You'd ask, what about measuring LH levels in dogs, or do you just go right to suprelorin? So I had a graduate student who was studying urinary incontinence. And urinary incontinence was actually the first LH-related study that we were involved with. At the time, we were using a GnRH vaccine to lower LH levels because the GnRH vaccine was labeled for use in dogs and it was available in this country, whereas, of course, suprelorin wasn't. And so that's what we were using. One of the reviewers of a paper that we had written said, okay, you've measured all the LH levels in these dogs that are incontinent. What about age match female dogs that are continent, what are their LH levels? And of course, we didn't have that data. So we solicited patients that came in through our teaching hospital that were age-matched continent controls, spayed with the permission of their owners, that were getting blood samples for other reasons to let us use a little bit of their leftover blood to run LH levels on. And what we found was that it didn't matter whether they were incontinent or not, the LH levels were high in both spayed groups of dogs. Of course, the reviewer says, why is it that some dogs develop urinary incontinence and other dogs don't develop urinary incontinence if LH levels are high in all dogs? And then that throws back to biology. Why some dogs become profoundly overweight after being spayed and neutered, where other dogs don't become as profoundly overweight. Why some dogs are more likely to rupture their cruciate ligaments over other dogs. These are all, biological differences between individual dogs, whether they're purebred or mixed breed dogs. And I like to think that biological difference has to do with LH receptor distribution. But we know that after dogs are spayed and neutered and LH levels rise, the number of LH receptors present in the tissues increases. And it increases in both dogs that we see the disease and dogs that we don't see disease.
Why do you think is that it suddenly increases in numbers?
There are, in most hormone feedback loops, as the hormone concentration increases in circulation, that increased hormone concentration will decrease its receptor number in circulation. By doing that, it essentially prevents overaction of that high level of hormone. As the hormone level goes up, the high level of hormone causes the receptor number to go down. That's the normal feedback system that happens with a number of different hormones in the body. It happens with progesterone, estrogen, testosterone. Certainly the steroid hormones respond that way. LH happens to be one of really a handful of receptors or of hormones that actually stimulates the production of its receptor. And I use the example of ovulation to explain the physiology behind this, because at the time of ovulation, there are LH receptors present on the granulosa and theca cells of the growing follicles. And as LH levels are increasing, more and more LH receptors are becoming present. And then that is weakening the wall of the follicle. And then the net result of more LH receptors results in this event of ovulation.
Wow.
And then, of course, LH levels go down and you have diastrous highs.
That's a real problem, isn't it? That's a real problem. And I find it absolutely fascinating. And the level of and the depth of knowledge that you have, I appreciate it so much. Now, I know that many of our viewers and listeners will be wondering. So I live in the United States. I'm convinced that my dog has gotten worse after it was spayed or neutered. I would like to try this treatment. My dog is suffering, is unwell. Is there a solution other than convincing the government and the authorities and the regulatory authorities to actually release this medication for use in veterinary medicine, because it's so important? And I personally have seen the profound effect, have been humbled by me, for years saying I would never use any drug on my dog of this kind. And suddenly I'm faced with the results and knowing how much better my dog is, and that I can't really put the balls back in his sack, right? So that's the only thing that I can do. Is there any other solution than really like changing the regulatory situation in the United States? Luckily that we have it in Canada, it's available now, but for the US dog lovers.
Virbac is the manufacturer of Delzlorin or the Suprelorin implants. They hold the patent on the development of the drug, the implant, the implanter. So I don't foresee this technology being held by another company or being generic or anything like that. Virbac, even though it's this huge multinational global pharmaceutical company for both veterinary as well as human pharmaceuticals, each country is essentially its own company. Virbac Canada is a completely different company than Virbac United States, which is a completely different company than Verbeck, Mexico, and so on around. I know that there has been groundswell of enthusiasm by veterinarians and even Verbeck employees in the United States to bring this drug to, for use in veterinary medicine other than just ferrets. The hurdles that even the company would have to go through, not only financial, bringing a new drug to market, but also all of the research that they would have to do, even though all of those research studies have already been done in Australia and Europe and Canada. The United States says, no, we have to have our own set of studies, which from an animal welfare standpoint seems, a ridiculous excess, use of animal testing. Why would we need to continue to test it when it's already shown, safe and we've done the testing? But these are the impediments that are in front of, Verbeck North America from bringing Prelerin for use in veterinary medicine outside of just ferrets. And so for veterinarians wanting to provide Verbeck, the Prelerin implants to dogs, they need to import them into the United States. Traditionally, we've been doing that through Australia, and we get special, like I said, permission through customs to have the implants brought in to the country. Having said that, sometimes, even though we had all of our paperwork in order, the implants were confiscated by customs. So that's a challenge for sure. Now that implants are available in Canada, it is easier to import them from Canada, but still to do it legally, you need to go through the paperwork to get approval in order to bring the product in. It comes in a box of 5 implants, 5 implanters, and with the 4.7 milligram size, which is what Canada has, there's actually 2 4.7 milligram implants inside one package with the implanter. And just, kind of telling you that you get a decent amount of product when you go through the effort of bringing it in.
I thought that this interview is going to be solving all the problems, and now we have the problem of the Prelerin not being allowed for dogs in the United States. It sounds like the ultimate solution is to promote hormone-sparing sterilization or not spaying and neutering our dogs responsibly, meaning that we should not let them breed and have overpopulation of dogs. But that seems like the only solution. I know that people will have a lot of questions about this, and I'm happy to answer them as much as I can. And I hope that you won't get flooded with emails and phone calls.
That's fine.
You've been absolutely generous. I'd like to touch upon the behavior changes that you were mentioning and what you've been seeing and noticing. And if they can get hands on the treatment, what should they be looking for before they try Prelerin?
I'll just mention 2 main behavior classifications that we know become more problematic after the dog has been spayed and neutered. First is fear. We think of fear as being a singular behavior, but it's a huge complex of behaviors. Some people will refer to it as timidity. So maybe that's slight fear, the other end of the scale, like aggression, fear-based aggression. But when we talk about fear and fear behaviors, we know based on a number of studies that have shown that we see an increase in fear-related behaviors after a dog has been spayed and neutered. That's comparing them to the same dog before and after, so the dog is serving as its control. When we have used Prelerin implants, typically to treat dogs for other problems, whether it's urinary incontinence or because they've had a cruciate ligament rupture in one knee and we're trying to prevent the other knee from developing a cruciate ligament rupture. One of the very frequent responses we get back from people is they seem like the dog they were before they were spayed and neutered. They don't seem as fearful of everything. That fear, like I said, can manifest itself as everything from just being more timid, but all the way, to, outward aggression. The aggressive behavior has also been studied in a number of reports, both, breed specific. So just in Springer Spaniels, just in German Shepherds, but also in mixed breed dogs. I don't want to describe aggression as it's only one behavior as well, because it too is a huge complex of behaviors. But we see an increase in aggression after dogs have been spayed and neutered, especially if dogs are showing aggression at the time they are spayed and neutered. And the reason why I want to draw kind of clarity on that subject is that I often have heard dog owners or veterinarians tell me that particular dog needs to be sterilized because they're acting aggressive. According to the data, that's not that sterilizing them is likely to make them more aggressive, not less aggressive. And whether that has a fear-based component or it comes as a form of anxiety. Anxiety is another huge complex of behavior, but we know that anxiety has also been demonstrated to increase after spaying neuter. Anxiety can be manifested perhaps in fear-based behaviors, maybe it's even aggression as well. Often what we think of are these dogs that when you leave the house, because of, there's the fear of being left alone or what we would sometimes call separation anxiety, the dogs become very destructive, vocalize, and neighbors are alerted because the dog is howling or barking so much, or maybe even self-mutilate themselves because they're so anxious. And these anxiety type behaviors are significantly lessened as well following suprelorin administration. So not trying to sell this particular implant as the fix-it drug for everything, because these are all complex conditions that dogs can have. But we know that these conditions all are reported to increase in dogs after being spayed and neutered. And we have seen them be reduced in their severity following suprelorin treatment when the suprelorin is used for some condition unrelated to the behavior.
So this is super interesting. And if I could have a light bulb just kind of above my head right now, it would show up right now, because my dog is a service dog, a certified service dog for my sleepwalking. I sleepwalked through Glassdoor when I was about 22 and I almost died. And I lost about 3 liters of blood, which is about 3/4 of a gallon for my American friends. I usually have a service dog that is trained for my sleepwalking, and he's able to grab my hand if I sleepwalk or turn on the lights and all this stuff. So when I started training him, he was not neutered, and we started flying with him. And the first takeoff on the plane, he was on the back, he was completely relaxed and all that stuff. And at certain point, and now I know that it was after he was neutered because I kind of put the dates together, he started being very anxious during the flight, especially during takeoff and for about half an hour to an hour after. It's been a little bit of a problem because, suddenly I have a dog that was not afraid of flying. He's now afraid of flying. So I'm really curious to see what's going to happen after, we started the treatment. The other thing is that at night, he would start barking if there were sounds or deer around and deer sounds. Like he would be really anxious and running around the house and anxious. Since we put him on the medication, once again, that behavior reduced by 80, 90%, I would say. And he's still in the habitual phase of that behavior, but he's so much more relaxed and almost like relieved that he doesn't need to do that. And based on what he said, the LH receptors are in the amygdala and the governing regions for emotion.
Hippocampus. Yeah.
Hippocampus and amygdala. So that would make a lot of sense. Again,
yes,
this is probably just a start of our journey as veterinarians who kind of understand this. And we just have to persist.
And again, I try not to put myself in a dog's position too much, but I think of how unnerving it must be if you always are feeling hyperstimulated.
Yeah.
And there isn't anything that you can do about it. And you can't explain to your owner, please help me. I'm feeling hyperstimulated all the time. So, being able to take that hyperstimulation away, I think is great.
Yeah. We know that hormones affect our moods and behaviors from human medicine and psychology and psychiatry. How could we not accept that this is also the case in animals, in dogs and cats and so on?
Right.
Yeah. Wow. This has been such a interesting, igniting conversation. It definitely has transformed my view of many things in what I've done in the past and so on. It doesn't discount necessarily what we've learned about nutrition and physical therapy and the effect of different natural treatments or conventional treatments on the body. But
Absolutely. I mean, I think that you have to be holistic in your both your diagnostic approach as well as in your treatment and prevention approach
mm,
when it comes to,
mm,
taking care of animals. And this is just part of that holistic approach.
I'm eternally grateful for your time. I can't even say how much I appreciate all you've said. And I suspect that this is not the only time we get together. I hope that we'll see each other soon in person and maybe we'll record another video and
That sounds good.
somehow get ourselves organized in making things happen for the dogs around the world and provide more and more information. So I really look forward to it. Thank you so much.
I look forward to it too. Thanks a lot.
Take care. Bye bye.